everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about viral hepatitis. So, a viral hepatitis means that there will be inflammation of liver, right? So, it is a systemic infection which affects the liver predominantly, and then we can also see that there would be primary inflammation of the liver, right? So that is what we call it as viral hepatitis, right? So basically you have to remember that in, when we are talking about viral hepatitis, that means the liver is affected and, there is inflammation of liver, right? So how this is caused? Now, the viral hepatitis is caused by hepatitis virus, right? So we have several types of hepatitis virus. So this could be hepatitis A, B, C, D or E virus, right? So any of these virus can, cause viral hepatitis in a person. So viral hepatitis is actually caused by, if there is over usage of drugs or over usage of alcohol. In that case, we can see viral hepatitis in adults, right? So, and also most commonly it is by viruses. So here, as we are talking about pediatric lines, for pediatric children, definitely, these causes are not that evident, that is over usage of drugs or excessive alcohol consumption. So these are not that evident for children. So there we would mainly focus about the viruses, because in children hepatitis or viral hepatitis is actually caused by, or most commonly caused by, the viruses. Now viral hepatitis could be acute, right? So if it lasts for less than 6 months, it is considered as acute viral hepatitis, and if it lasts for more than 6 months, in that case we call it as chronic viral hepatitis. Well, now next, we are saying that here the liver would be affected, right? And there would be inflammation of liver, right? So if the liver would be affected, that means the liver won't function properly, right? And if the liver doesn't function properly, what are the problems that might happen? To understand that, we have to, we have to be very familiar with the functions of liver, right? So what a healthy liver does, right? So if we talk about the functions of liver, then it helps in bile production and excretion, and also it helps in excretion of bilirubin, cholesterol, certain hormones and drugs. Next, it also helps in metabolism, right? So there's metabolism of fats, proteins and carbohydrates by the liver. Also there is, enzyme activation activities. There is, it also helps in storage, right? So storage of glycogen, vitamins and minerals. And apart from all these things, it also helps in synthesis. So there are certain plasma proteins which are synthesized by the liver, then, such as albumin and clotting factors. So these things are synthesized by the liver, right? So if we talk about the functions of liver in one statement, if we want to say what the liver does, then we can say that it helps in detoxification, synthesis and storage. Well, so you can understand that if the liver is not functioning properly, what are the things that would actually get affected, where we can see the abnormalities, right? The deviation can be seen. So we are saying that it helps in excretion, right? Now, for example, if we talk about ammonia, right? So what happens, this ammonia is actually, the liver actually breaks down this ammonia, right? It breaks down the ammonia into urea. Now this urea gets excreted in the urine. By how? By the kidneys, right? So ammonia is such a form which cannot be excreted by the by the kidneys, right? So that's the reason there is liver, and the liver breaks down this ammonia to such a form which can be excreted by the kidneys, right? So this is supposed to be excreted in the urine, right? Now this is not good for our body, this is not good for our brain, right? So if the liver isn't functioned properly, that means it is not getting break down into urea and it is not getting excreted from the body, right? So what would happen? This ammonia would start to build up, right? It would start to build up in our body and it would eventually affect our brain. Well, so this is how the liver would, get affected, and the functions of the liver won't happen properly, right? Next, let us move on to the symptoms. Now, we learned that hepatitis or viral hepatitis could be acute or it could be chronic, right? So the symptoms of an acute case is very much different from the symptoms of a chronic case, right? So in acute cases, what are the symptoms that we can see? So there is a sudden infection in the body, right? So that's the reason there will be fever, there would be malaise, nausea, vomiting. Also, the child will have anorexia, and there would be jaundice. Now, why jaundice? We learned that the bilirubin is excreted by the liver, right? So again, the liver isn't functioned properly, right? In hepatitis. So what would happen? This bilirubin won't be excreted, right? So it would start to build up and it would leak into the skin because it has nowhere to go. So it would start to leak into the skin, and that's the reason there will be jaundice. Also, there will be dark urine, and apart from that, there will be tenderness. So, basically, in the right upper quadrant, right? So, as there is inflammation of the liver, you can see there would be tenderness also, right? Apart from these things, there will be splenomegaly and lymphadenopathy. So these are certain symptoms which are, we can say that these are hepatic symptoms, right? So apart from these things, there could be also extra hepatic signs and symptoms. Now, what are the extra hepatic signs and symptoms that we can see? So there could be rashes, there could be arthritis. Okay, so these are more seen in hepatitis B virus or hepatitis C virus. So we said that there are several hepatitis virus, right? Hepatitis A, B, C, D, or E, right? So when we are talking about extrahepatic signs and symptoms, these are more common, or we can say more evident, in case of hepatitis B virus and hepatitis C virus. Next, in case of chronic cases, right? So in chronic cases, what are the symptoms that we can see? Now, in chronic cases, it is mostly asymptomatic, right? So there won't be any symptoms that you can see. So it's basically asymptomatic, and sometimes, in some cases, you can see that the child will have malaise and fatigue. Right, now, next let us move on to the phases of viral hepatitis, right? So any disease that progresses through phases, right? We know this. Now, here in viral hepatitis, we have again phases. So the first phase is pre-icteric or prodromal, right? Now, this is the first stage of hepatitis which precedes the appearance of jaundice, right? So remember that this stage or this phase precedes the appearance of jaundice, but here in this phase particularly, the jaundice won't be evident, right? And next thing, there are certain body symptoms that you can see, right? Certain physiological symptoms. So what are those symptoms? So there would be joint pain, there would be fatigue, also there would be gastrointestinal pain, the child would have nausea and vomiting, also there would be change in taste and increasing liver enzymes and bilirubin, right? So you can understand at this stage or this phase, the bilirubin would start to increase, right? It would start to build up. So this would precede the appearance of jaundice. The next phase is icteric phase, right? So in icteric phase, we can see that there would be decrease in symptoms, right? So whatever the symptoms that we talked about in the post-icteric phase, that is, the child will have body pain, there would be nausea, vomiting, and all the symptoms that we talked about, these symptoms would start to, decrease in icteric phase. And with that, there would be jaundice. The child will have jaundice. Also, there will be dark urine. There will be clay colored stool, because there is, the bilirubin is building up. There is increased level in the bilirubin, increased level of bilirubin in the body. So there would be clay colored stool. Also, there would be enlarged liver and there will be pain. And the next phase is post-icteric phase. This is also called as convalescent phase. right? So in convalescent stage, what are the things that we can see? So here the jaundice would start to decrease, right? So the bilirubin level would start to decrease, and the color of the urine and the stool would also return to normal. So you can understand that when the level of bilirubin is decreasing, then definitely the color of the urine and the stool would also return to normal. Alright, so these are the three phases of viral hepatitis, right? Now next, let us move on to the types of viral hepatitis, right? So we have learned that there are several types of hepatitis virus, right? Now if it is caused by hepatitis A virus, we call it as hepatitis A. If it is caused by hepatitis B virus, it is hepatitis B. So likewise, we call it as hepatitis A, B, C, D or E. Well, so first we would talk about hepatitis A. So when we are saying it's hepatitis A, that means it is caused by hepatitis A virus. Right now, how does it transmit? So the transmission happens through ingestion of contaminated food and water. So what you can understand that the transmission is actually through fecal-oral route, right? And this is the most common cause of acute viral hepatitis, right? Now, who will be at risk? So people who are regular travelers, right, who who are traveling to developing countries, especially, they are at more risk. Or people who work in daycare, or work as daycare workers, they are also at more risk, right? So we understood that this transmission happens through fecal-oral route, right? Now, what is the incubation period? So the incubation period of specifically of hepatitis A virus is actually 30 days. And if we talk about the symptoms, so if we see the symptoms in adults, so we can see it's in more severe form, right? The symptoms would be more severe. Now here, as we are talking about children, in children the symptoms are quite milder. So we learned that viral hepatitis could be acute, it could be chronic, right? But here you have to remember that a particular type of hepatitis virus can be acute, or it could be chronic, or it could be both, right? So here we are talking about hepatitis A, which actually cause only acute cases, right? So this does not progress to a chronic infection or chronic hepatitis, right? So the prognosis is also quite good. Now, the next question is that how we would get to know that which virus has affected or which virus has caused the disease, right? So for that, we have to, if we find out that there is anti-HAV IgM antibody, that means if there is anti-hepatitis A virus IgM antibody, and that indicates that there is an active infection. Why? Because this is a kind of antibody which is produced in the early stage of the infection, right? So if this is found in the blood, that means there is an active infection. And if we find that there is anti-HAV IgG antibody, right? Now this antibody is a kind of protective antibody, right? So this protects you from getting the disease, right? And it is produced later on. So if this is detected, that indicates that either the person is vaccinated against hepatitis A virus, or the person have had an infection, a prior infection. Right, so anti-hepatitis A virus IgM antibody is actually produced in the early stages of the infection. So this is to, this is a kind of antibody which helps in fighting with the infection, right? It produced early on. And IgG antibody is actually a protective antibody which actually helps in protecting the body, right? So it would protect the person from getting the disease, right? And that's why this indicates, and this is also one more thing, that this is produced later on, right? So this is how we can get to know that if the person is having an active infection, or the person is have had an infection, a prior infection, or if the person is vaccinated. Now, whenever we talk about any disease or progression of any disease, we know that there is also a carrier stage, right? And sometimes, people would be carrier, they carry the disease, they carry the infection, but they won't be aware that they are having the disease because, there won't be any signs and symptoms, right? But they would spread the infection at this stage. So here in hepatitis A virus, or hepatitis A, there is no carrier stage where they do not have the symptoms, but they can spread the infection. So within 3 to 6 weeks, there will be complete recovery. And if we talk about the treatment, now treatment, we don't have any specific treatment. So whatever we do, we give it a supportive treatment, right? And again, for preventing this, we have got vaccines. So we have vaccines against hepatitis A virus, right? One more thing which is very, very important when we are talking about treatment, that is hand washing, right? So this is, we learned that this is transmitted feco-orally, right? So feco-oral route is that is the route through which the virus enters, right? So here it's very important that the person who is affected, or the person who are not affected also, they should thoroughly wash their hands, even before having food, after having food, and there should be frequent hand washing, right? So this frequent hand washing can prevent this disease, and also this frequent hand washing would help in recovery. Well, so this was about hepatitis A. Now next, let us move on to hepatitis B. Right? So hepatitis B is actually a DNA virus, right? And this virus is actually transmitted through blood or body fluids and through sexual intercourse, right? So we are saying that it transmits through blood and body fluids, right? So again, when we are talking about a pediatric client, the question is that whether it transmits from mother to the fetus, right? Which is very important. So that means if the mother is infected, the fetus can also get it, right? So that is an important factor that we have to know, right? So hepatitis B is something that is transmitting through or getting transmitted through this blood or body fluids, right? So definitely that question is there, right? So there could be mother to fetus transmission, right? Now this transmission may occur in the uterus, right? Which is, the chances of this transmission is very less, but it can occur, right? It can also occur at the time of birth, right? This is the most common time, we can say, or most commonest in all the incidents that we can see, that after or at the time of birth, it is most of the time the mother, from the mother, the fetus would get this disease, right? Or after birth also it can transmit. Now if again, there is one more thing, that whether through breastfeeding it can it can transfer to the child or not, right? So breastfeeding does not appear to increase the risk of transmission. Next, we also said that it is transmitted through sexual intercourse, right? So the male homosexuals, they are at high risk for getting this infection. And if we talk about adolescents, then if there is IV drug use, there could be contaminated needles, sexual contact, institutional care, and intimate contact with carriers, right? So these are the things that through which we can see that adolescents may get affected with hepatitis B virus. So here we have a carrier stage, basically, right? So where they won't have any symptoms, but they can spread the infection. Next, unlike hepatitis A virus, this has this can be acute, or it can be chronic, right? And infants and young children, they are if they are having perinatal exposure. So for example, if the mother is hepatitis B virus positive, right, antigen positive, then in that case they are at more risk. Now how we can diagnose this? So again, if we if there is HPS antigen, that means there is active infection in the body. And if there is HPS, that means the person is immune or the person has recovered. Now again, talking about the treatment, we don't have any specific treatment for hepatitis B virus, so we would give supportive treatment, and for chronic cases we would we would give antiviral medications. Now we have also got vaccine for hepatitis B virus. So when it is given, now this there would be hepatitis B immunoglobulin and hepatitis B virus immunization. So this is given within 12 hours of delivery, and this is very effective. So this protects almost more than 95% of neonates from getting hepatitis B virus. And this is mostly given to the neonates who are born to HPS antigen positive mothers. So in that case, it is very effective. Now in hepatitis B virus, you can see that this can cause extrahepatic manifestations also. So when we talked about the clinical manifestations, the signs and symptoms, so we learned that there would be some hepatic signs and symptoms. Also sometimes it can cause extrahepatic symptoms, right? So this is a particularly or specific disease, hepatitis B virus. This can cause extrahepatic manifestations. So whatever symptoms that we learn, all the symptoms would be present. Along with that, it can also cause certain extrahepatic manifestations. So there would be, there might be hematologic manifestations. So the child will have aplastic anemia. Also, there would be, there might be renal involvement. So for that we can see membranous glomerulonephritis or membranoproliferative glomerulonephritis. Also, there could be vascular manifestations. In that case, we can see polyarteritis nodosa. Now, we mentioned that this, hepatitis B could be acute or it could be chronic also, right? So if we talk about the risk of developing a chronic case, then in children it is not that much. It is, we can say that there is 20 to 30% of chance that it might develop to chronic case, right? But in neonates it is very high, right? So the neonates are at more risk of having a developed or having a chronic case, right? So the neonates are almost 90% risk of having a chronic case. And mostly for for the treatment of hepatitis B virus, we use interferon alpha. So this is mostly used for the treatment. Well, next let us move on to hepatitis C virus. So hepatitis C virus is a single-stranded RNA virus. Now we said that hepatitis B was a DNA virus, right? And hepatitis A was again a RNA virus. Hepatitis C is also a single-stranded RNA virus. And this is, this is spread through blood or body fluids. Also, there could be needle stick accidents. Through dialysis also this can be transmitted. Now, whether intrauterine infection is possible or not, right? So again, hepatitis C virus is also, this is also a kind of virus which can be transmitted from mother to fetus. So there could be intrauterine transmission during the pregnancy. Also, this infection might transfer or might, transmits at the time of delivery. So both of these things are possible. So in most of the infants, we can see that, if they are infected with hepatitis C virus, the level of hepatitis C virus RNA is actually detectable after several weeks or several weeks after birth, right? So this suggests that there is a perinatal infection. Because of that, the child has got hepatitis C virus. Well, so we said that it could be transmitted through blood or body fluids or needle stick injuries, or if there is, during dialysis also, right? But among all these things, the most common cause or the most common transmission which happens, it happens through IV drugs. Well, so that means if there is maternal IV drug use also, in that case also there is a chance that there might be transmission of hepatitis C virus. Right now, there are certain risk factors. So, the risk factors are actually invasive prenatal testing, or if there is prolonged rupture of membranes, or if there is obstetric procedures. right? So these are considered as risk factors for for the transmission of hepatitis C virus. So here again we can see both the cases. There could be acute and chronic, right? But mostly we can see that it causes a subtle chronic infection which leads to cirrhosis and hepatocellular carcinoma, right? So mostly, we can see that if we see the occurrence of this hepatitis C virus, then we can see that the acute cases are not that much prevalent. Most of the time, hepatitis C is a chronic case. Again, how we would diagnose it. So again, we would get anti-HCV, anti-hepatitis C virus, and then there would be treatment, right? So for treatment, we use antiviral medications. Well, next, moving on to hepatitis D virus, right? So this is also, a virus which could be transmitted through blood or body fluids, and it cannot occur unless the patient has hepatitis B. Right, so this is something where the first the child would be affected with hepatitis B virus, and then only there is a chance that hepatitis D might occur, right? But this hepatitis B virus is not a kind of, we can say that it could be a primary infection. So if there is no no history or no signs and symptoms of hepatitis B virus, in that case it cannot occur, right? So unless the patient has hepatitis B. Again, here also we can see acute cases and chronic cases, and we can make the diagnosis based on hepatitis D antigen and anti-hepatitis D virus, right? So the treatments would be, again, supportive treatment, and again we have hepatitis B vaccine, right? So the child will be given with hepatitis B vaccine first, because again, if there is hepatitis D virus, that means the child already has hepatitis B virus, right? Hepatitis B. So in that case, we would first give vaccine for hepatitis B. So first we have to cure hepatitis B, then only this can be cured. Well, next let us move on to hepatitis E, right? So again, hepatitis E is caused by hepatitis E virus, and it is a RNA virus again, right? So the transmission happens through fecal-oral route, and mostly we can see that it happens in areas with poor sanitation, right? So if there is undercooked seafood or contaminated water, through all these things this can be transmitted. Now this is very common in developing countries. So as I mentioned earlier, that this is, this mostly happens in areas with poor sanitation, right, which is very common in developing countries. So again, next is it is a disease where there is no chronic cases. We can only see acute, right? So this does not progress to chronic stage, right? Next, if the person, if the pregnant mother is having hepatitis E virus, then after, or in the third trimester especially, there are many complications that might occur, right? And how we would make the diagnosis? So again, we would check for antibodies against HEV, and that's how we would make the diagnosis, right? Next, moving on to the treatment. Treatment, again, we don't have any specific treatment, so whatever treatment we'll give, it would be supportive treatment. Next is fulminant hepatitis, right? Now this is a very rare hepatitis, but it's a very severe form, or severe, we can say severe complications of hepatitis, right? And this require liver transplantation. So we already know that in hepatitis the liver would get affected, right? It won't function properly. So this is fulminant hepatitis is something where it's a very, very severe complication of hepatitis. So here we can see that there will be liver, the person would require liver transplantation, and also there would be rapid and massive necrosis, and it would eventually lead to liver atrophy. Well, next talking about the investigations, right? So again, in investigations, we will check for the ALT. So the normal ALT is, 7 to 56 unit per liter. And we would check for AST. So that is also the normal level is 10 to 40 unit per liter. And these liver enzymes, right? These are the liver enzymes, ALT, AST, right? So we know the normal level, but in hepatitis, what we can see that these liver enzymes would be elevated. Also, the bilirubin level would be elevated. The normal bilirubin level is less than 1 mg per dl, right? And in hepatitis, we can see that it would be elevated. Again, talking about ammonia, the normal level of ammonia is actually 15 to 45 mcg per dl, and this would be elevated in hepatitis. Well, so we have talked about all the types of hepatitis, and we learned that how it could be a specific type of hepatitis virus, how it can be transmitted, also what are the treatments that we have to provide, and what are the risk factors, how it could be managed, and whether we have got vaccines for that or not. Right now, next let us move on to the nursing management. So in nursing management, first we would talk about nursing diagnosis, right? So nursing diagnosis, definitely the child will have imbalanced nutrition, less than body requirements, which would be related to insufficient intake to meet the metabolic demands, right? So we know that the liver enzymes would be elevated, the liver won't function properly, right? And we also know that it helps in metabolism, right? So because of that, impaired liver function, with the child will have imbalanced nutrition. Next, also the child will have risk for deficient fluid volume, and this would be related to excessive losses through vomiting and diarrhea. So we have learned, in the signs and symptoms that the child will also have nausea, vomiting, right? So these things would increase the risk for deficient fluid volume. Also, the child will have acute pain related to inflammation of liver. So these are some of the nursing diagnoses. Now next, let us move on to the nursing interventions. Well, so in nursing interventions, the first and foremost thing about, about viral hepatitis is actually maintaining hygiene, right? So we know that it transmits through fecal-oral route, right? And because of that, it's very important to maintain hygiene, right? So hand hygiene, we basically have to practice hand hygiene. We have to make sure that, the child is not sharing any personal hygiene products, or if the mother is positive, in that case also she is not sharing any personal hygienic products. Also, the child will have individual bathroom, or the mother will have individual bathroom if they are, infected with hepatitis. Next, you also have to make sure that you provide low fat and high carb diet. Now, why specifically low fat and high carb diet? So we know that the liver produces bile, right? So what this bile does, now this bile helps in breakdown of fat, right? And here we know that in hepatitis, the liver isn't producing enough bile, right? So definitely there won't be breakdown of fat, and that's the reason we have to provide low fat and high carb diet. Also, we have to make sure that the child is taking adequate rest, because the child will have fever, malaise, the child will also have fatigue, right? So we have to ensure that the child is taking adequate rest. Also, we have to avoid aspirin and acetaminophen, and we have to monitor their lab results continuously, right? What is the level of the enzymes, the bilirubin, everything. And then we also have to ensure that we provide small and frequent diet. So as the liver isn't producing enough bile, the liver isn't functioning properly, and we know that it helps in metabolism also, right? So we have to make sure that we don't provide large meals. We have to provide small and frequent diet. Also, we have to maintain adequate hydration in the child by encouraging the child to drink more of fluids, more water, and we have to encourage the child to eat meals in a sitting position, because that would reduce the pressure on the liver. Well, so that was all about viral hepatitis. So I hope you have got a better insight about the topic. Thank you.